So the next question on this list says, why do I need a crown?
Why do I need a crown? So there's multiple reasons. I mean, the main obvious reason is if the tooth is completely broken down and there's not much there, that we need to build it up somehow, so we put a crown on it. Other reasons is, for example, there's a root canal tooth and there's a large filling on it. We don't always have to do it if the tooth is root canaled, but if there's...
It's brittle, isn't it? The tooth becomes very brittle.
Very
so
brittle.
So do you suggest it normally?
Yeah.
Yeah, because just when we do a root canal, the nerves become, or the tooth becomes really dry, there's no liquid inside that it can break. So a crown provides a really nice coverage and protection for the tooth for the long term, just to keep it in as long as possible.
For the benefit of our viewers at home, I think we need to rewind and just explain what a crown is.
Yeah, so a crown is a full coverage that goes directly over the tooth. So what we do is we shave down the tooth about a millimeter and a half, and we take a mold of the teeth and we send that off to the lab, and it brings us back something just like a hat that goes over
Like a capo.
exactly over the whole tooth to cover it up, and it looks really nice. The porcelain that we use is amazing quality. It looks very natural. The shape is really natural. We try to match it as much as we can to the natural tooth anatomy. The color to the same teeth as the other.
Yeah, I would say, again, we're lucky that we're working in this day and age where the materials that we're using nowadays cosmetically look amazing.
Yeah.
Again, I sound like I'm from the 20s.
Yeah,
Gold
crowns.
crowns,
Yes.
gold crowns, I know. Gold crowns,
Crowns are amazing.
those are the first crowns we did, gold crowns.
Yeah.
And that's what they teach you at university, gold crowns and metal ceramics. So they have those horrible black lines around them sometimes, which patients really didn't like, but you had no other option. Nowadays, all of that is gone. I mean, they look
So
pretty
it's
much...
always ceramic now, right? Nothing.
Yeah, pretty
Well,
much.
I mean, unless a patient requests gold, because
Gold's the gold standard.
gold's amazing.
Yeah, it's the best, still the best material. I wouldn't say, never say never, but most of the time I would use ceramics only.
Ceramic,
Yeah, I wouldn't use anything with metal anymore. I'd still, if you ask me, I'd still like to use gold, but patients don't want it.
Yeah.
So, yeah. So that's where we're at. Okay, so that's what a crown is and why we need it.
And how long do they last?
How long do they last?
I mean, nothing is guaranteed in life, but on average we say they could last about, if they're done really well, a good 10 to 15 years.
Yeah, again, depending on the material, depending
on
whether you floss, whether you clean it
on the
properly,
hygiene,
The
the
patient looks
diet.
after them.
if they've had ortho treatment or not,
Yeah.
all of these things. So
If they grind.
if they grind, exactly.
Yeah.
But they're generally the longest lasting thing we have that we
Yeah.
do in dentistry.
No, they're very good. I mean, just the hygiene and the diet, those have to be kept really well, and then almost everything will be done really well.